Welcome again. It is still good morning, Anambra, and I'm still rolling with Dave Opokwasley.
Yeah.
Welcome. Okay, for some time now, the Anambra State Primary Healthcare Development Agency, in collaboration with 71 Million Lives program, have been carrying out an immunization outreach to reach the hard-to-reach areas in the state. The immunization, as a matter of fact, is for children from 0 to 5 years and for pregnant women too. Okay, and no doubt it hasn't been an easy task. And this morning we want to find out how far so far. And we'll have a gentleman that has joined us. He's a medical doctor, Dr. Kanayo Onalo, Head, Community Health Science in Anambra State Primary Healthcare Development Agency. Welcome you, Dr. Kanayo Onalo.
Okay, thank you.
You're welcome.
Welcome.
Yeah. Now, we would like to find out how far you have gone in this immunization exercise in our communities.
Okay, thank you. Immunization exercise in the communities is not just the outreach. It's actually based on routine services that you assess through the primary health care facilities and in some secondary and equally the private health facilities in the state. But because we don't most times have a very good coverage where you expect the mothers to come with their babies to the facilities, we decided to be able to reach these children, we had to take immunization services to the communities. So that is what actually led to this campaign, not campaign in the sense of immunization campaign, but the campaign of outreach services in the state.
Okay.
And I would say the coverage has been okay.
The coverage has been okay. Can you give us what the reach is like? Is there a measurement system you use to ensure that you've improved over time? Okay,
yeah. It's still ongoing, so you don't at this point, because it's a kind of evaluation.
Okay.
Yeah, so the evaluation has to be done at the end of the services. Yes.
So you said because we don't usually have a high rate of coverage when you expect mothers to come to the hospitals and engage in those vaccinations.
Yeah, okay.
What do you think is the major reason for those lower coverage, especially in Anambra State?
Well, Anambra wouldn't be said to have comparatively low coverage, because if you remember, about 2 years ago, Anambra came first in immunization coverage. Yeah. So, but the only thing we know that it's more difficult maintaining the top position than even achieving the top position. So it's actually to try and be sure that we maintain that position, that we can't say that Anambra has a low immunization coverage.
You said that women usually don't come out.
Yes.
And therefore you have to adopt the strategy of going house to house or opening the campaign beyond the hospital premises and primary healthcare centers. Yeah. I'm now asking, why do you think women do not usually keep to date with or maintain that vaccination regime they were supposed to keep at the primary healthcare centers?
Well, the reason is very obvious. If we look at the society, generally, people think or believe that they have other more pressing needs, either going to fend for the family rather than taking their kids to the vaccination points. They prefer you coming to them, because actually it's a primary health care service, and the primary health care is actually taking the services to the doorsteps of the people where they live, where they work. So it's actually part of it, taking the services to actually where they live.
But I know that in some parts of Nigeria, we still witness this kind of resistance from some people that believe that immunization is not good for their children. do you encounter such challenges down here?
No, that doesn't account for supposedly the coverage not being up to what we expect.
Yeah, but there are still some cultural beliefs, like some grandmothers will tell you, did we do it? Yeah. So why should you bother going to do it? And yet they survive. But say, can I do it? Don't you encounter such challenges?
Well, we have pockets of such,
okay,
but it's not widespread. And when we encounter such, we have methods of dealing with them, because we reach out to those families where such exist. And in most cases, we end up resolving such issues.
Okay, let's hear again some of those inmates that you prevent with this immunization, starting from birth.
Okay, from birth. We think of there is hepatitis, there is polio, then there is the tuberculosis.
Which one was the first one? That's BCG. Which one? What does it take care of?
BCG, that's tuberculosis.
Okay.
Then there is HBV. That one takes care of hepatitis B.
Is it possible you also tell us the sequence?
Okay.
The one that comes after another.
Okay. At birth, you have BCG. That one is in injectable form. There is oral polio vaccine. Then there is hepatitis B. That's at birth. Then the next time is 6 months, where you still have oral polio. Then there is one now that contains 5 different vaccines that we call pentavalent vaccine. That one has presently there is tetanus there. There is let me be sure. There is the pentavalent prevents tetanus. There is tetanus. There is HIV, that and all those other things, and then
okay, that will continue till the baby is 5 years.
Yes. And okay. Then still at that point, you give. I mentioned penta. Then there is still the HB, okay. V. That is a spot, and so on.
So many of them.
Yeah.
Okay.
Still on this, you know, we were talking about why women don't come. We know that the Anambra Primary Healthcare Development Agency, since it came up in inception, had made several steps to ensure that the healthcare facilities at the primary level is upgraded and made more accessible to women. You heard the community health service in that agency. How have you gone to ensure that workers, the human resource at those points that should give these women those available immunizations are also available? Maybe it's also part of the reasons why some of these women do not go out to those primary health cares to access immunization services.
Okay. I know it's a general problem, not just in Anambra State. The question of paucity of healthcare, trained healthcare workers. And I know the government conducted an interview to aimed at recruitment of trained healthcare workers last year. And I know in a short while, the result will be released, and there will be an improvement in the number of healthcare workers, trained healthcare workers that we will have in our facilities. In terms of
health centers. Do you think we've had enough to cover our communities?
Presently there's this policy of one primary healthcare center per ward.
Per ward?
Per ward. It's a national policy. And I don't think we are faring poorly where it comes to... We don't have an issue with the number of the primary healthcare centers in the state. And recently, the government improved on 63 of them, renovated 63, and equipped 63 of them, providing them with equipment and tricycle ambulances, and in the riverine areas provided boat ambulances.
Yes, I was going to come with that riverine areas, because when we talk about our communities, we still remember that these people that are living behind the rivers are still part of us. How do you assess those areas, and would you say that they are part of these people that we are claiming we have covered?
Okay. In terms of the riverine areas, we are making a lot of efforts to cover those places. We have primary healthcare facilities there, and we have healthcare workers there who stay and live there. But we wouldn't beat our chest and say we have enough. Problem is always that of accessibility, and that is why the government has now provided boats.
The boats,
yes.
I'm aware of tricycle or
tricycle,
in some areas.
yes,
Ambulances.
tricycle.
But the thing now is, yes, this thing has been provided. What is the improvement that I've been seeing? I know it wasn't provided this year, so you must have done an evaluation on that.
Okay.
What is the improvement that you've seen over time that these provisions have been able to make in such areas? Because we know that riverine communities usually face more challenges because of their surrounding environment with water, more challenges than those who are in the upper lands. So tell us, what's the improvement you've noticed?
Remember, I said they were provided for those 63 healthcare facilities that were renovated. Then we found out that in those facilities, services had improved appreciably, because this is actually meant to be used when cases are referred. So when these people are referred, because ab initio you'll have referrals, you just refer. How do they access the secondary facilities where you referred to? You may find out you refer a case now. It may take them 3-4 hours to get to the referral centers. So most times you'll find worsening of the problems for which you referred them. So now you'll find situations where you refer, because most times these tricycle ambulances are fueled and they are ready. So once you refer, the patient gets into those and they'll be taken to the referral centers. So it has reduced drastically the time spent to get to the referral centers.
All right.
Thank you very much. We want to also look at the availability of this vaccine and how you assess it. Will you say that you have enough of this vaccine to go around?
Yes.
For you to be able to
Answer is
cover the community?
yes.
Okay.
We do. Because these vaccines come from outside the country, from the production point to the national store, then from there to the zonal to state. And we have a functional and well-equipped cold store in the state. It's in Amako. So from there, they are now distributed to the local governments, who equally have the immunization stores. From there, these things get to the endpoints. That's the facilities that make use of them.
Okay. And how often do you go on general immunization? Or is it a continuous thing? You do it every time?
Well, immunization, you have two different types. First is the routine, which is the basis for what we are doing. The routine is the one you access in the healthcare facilities weekly, right? Then from time to time, to boost this routine immunization coverage, you have what we call supplemental immunization activities, SIAs. And it's known as NIPDS, that is National Immunization Plus Days. And this, yes.
How often does it come?
About yearly, times twice in a year, depending on need.
All right. Remember, you can still join the show by calling any of the phone lines on your screen or send us your message via WhatsApp so that we can take comments and answer questions and contributions. Dr. Kana Onalo is the head of community health services at the Anambra State Primary Healthcare Development Agency. We are discussing immunization coverage in communities.
Okay. And then I also have WhatsApp numbers there. For those of you that cannot call in, you can send your message through the WhatsApp phone line there. As we move on, yes, we are still looking at immunization coverage in our communities, and we want to find out wherever you are, whether you have been properly covered, and that is why this program is interactive.
Exactly.
Okay. Do you have any issue with the immunization? And let's exactly find out why some children, since we have a medical doctor here, why some children, even after going through this immunization process, still have the image that we are hitherto prevented with this immunization. What really happens, doctor?
Okay, I'm sure you may be talking of measles.
Yes.
That's the problem.
And maybe chicken pox.
Chicken pox, we don't immunize against chicken pox.
Oh, really?
Yes.
Why not?
It's not in our immunization schedule for now.
Why?
Oh, well, it's not actually public health issue in this part of the world. It occasionally happens, and even when it happens, it gets resolved even on its own without treatment.
Okay, so, we've seen cases, though I wouldn't say it's in Anambra, but we've seen cases where complaints are given that vaccines didn't serve or the quantity brought was not enough to go around. Is that also, does it happen in Anambra?
No.
Okay, you wanted to give us the reason why after immunizing a child against measles and it still occurs?
Now, measles, it's a gamut of process. It's a long process from this stage to this stage. And what it actually does is not that you will not have something that looks like measles. First of all is there
anything that looks like measles that is not measles?
Yes. You may
have heat rashes.
Yes, heat rashes. And what do you find? People will tell you once they have heat rashes, I thought my child was immunized against measles, and here my child has come up with measles. That is number one. Number two, even when it does, it's only a mild type of measles, right? Because there is a severe form. This is a mild self-limiting type of measles, unquote, because most times it's not measles.
What is it? Because
she just mentioned
heat rashes.
Heat rashes.
Is there any other one? Because I know I had measles at a point.
Yes.
When I was a kid, not now, but I was older than the age of taking immunization. So, how would you tell a parent who is seeing symptoms that are more than heat rashes and tell them this is actually not heat rashes?
Yes, it depends on the doctor or the health worker who should be able to make a correct diagnosis.
Okay.
So most times it's a diagnosis issue. It may not be measles. There are other problems that can mimic.
Can you please educate us more on this? I'm very interested because before now, I don't have that. I feel measles happen and it's something that happens regularly. We also see at times, we see cases, minor cases of chicken pox.
Yeah.
Can you please educate us on those kind of things we'll see and we have to seek, we have to seek actually a medical advice?
Well, what I'll say at this point is once you notice such, go to a healthcare worker who will be able to educate you and make a correct diagnosis. So that is what I'll say about that at this point.
Okay, in your bid to cover, as we are running up, in a bid to cover all Anambra communities, immunization-wise, I'm sure you must have been encountering some challenges. May we hear those challenges now, both in our provision of vaccine, which you say, of course, you have enough, and then personnel and other issues.
Well, in terms of coverage, during the immunization campaigns, which is actually to boost the coverage of routine, that's why we do it. At that point, we most times, because it's all about polio eradication initiative. Yeah. So at that point, because what does it involve? Dropping 2 drops of the vaccine into the child's mouth. Here you don't need very highly trained health workers. You can still employ ad hoc staff. And since you most times have enough ad hoc staff, I think with that, we still cover the communities. And this is where you take the services to the people's houses, because you move from house to house. Yes.
Okay, but most times I see nurses that do that. So are you saying that most of them are not professionals?
No, I said you still employ to add to the trained staff.
And you don't have problem with finances paying the ad hoc staffs?
Oh, well, the state is doing enough. And at times,
the partner... We want to hear.
Yes.
We want to hear how far the state
yes, the state has been doing enough. And then the partners, the implementation partners, UNICEF, WHO, and so on, they've been helping.
All right. Is there a policy direction? Is there something new we're expecting to see because we're almost rounding up this segment? Yeah. We are seeing ahead in the processes that you engage in immunizing or engaging in immunization process through our communities. Is there something new? Is there something proactive that the agency will be doing after now?
Well, for now, what we are doing presently is to strengthen what we have at the moment. And we believe once these things are strengthened, we won't have a problem. In as much as we know there's still room for improvement. Right. But for now, we don't have issues with what we have when they are strengthened.
And any message to our people as we round up?
Well, I would say to our people, the next supplemental immunization activity, that's NIPDS, is coming up tentatively 29th of this month to 2nd of the next month. And I will say, make your children available for this.
Make your children available for immunization. It's for their own good, starting from birth. That's the one that they take from the birth, BCG, until she is 5 years old. Even the one they go about in their schools and the churches dropping in their mouths. That's still very necessary for your children to grow healthy. Well, thank you very much for joining us this morning. Dr. Kanayo Onalo, Head Community Health Science in Anambra State Primary Healthcare Development Agency. Thank you for coming, sir.
Okay, thank you.
Okay, and I've been around with Dave of Okwa Slade. This is just the first segment. You don't go away. We are still here.